Hello, my name is Richard Griffin. I'm Professor of Healthcare Management at King's College London. 2.5 million people in the UK are currently living with cancer. That figure is expected to rise to 4 million by 2030. Survival rates, though, are the highest ever in the UK. To support these people, to meet current need and future need, it's essential that we invest in the workforce. This workforce includes what we call supportive and assistive support workers. This is a large and diverse workforce. It includes people working in nursing teams, in allied health profession teams, in administrative teams and in pharmacy teams. They can be employed in GP surgeries, in hospitals, in community settings, but also support people at home. And they provide a range of support to people affected by cancer. Some of that is clinical support, some of that is helping people navigate the system, some is administrative support or combination of all of those. Coordinators ensure coordination and effective communication between GPs, hospital staff, community staff, patients and their families. Cancer support workers support clinical staff, perhaps preparing clinics or escorting patients or undertaking wellbeing calls. And there's a wide range of allied health profession support worker roles. These may include people working in dietetic teams, helping people with their diet. It may be those involved with physiotherapy teams or helping people with their mobility and exercise. And of course, staff working in radiography services. These are often key patient and family-facing roles that are pivotal to cancer care. They've been described as the glue that keeps the team together. And often they're recruited from local communities, so tend to represent the people that they are supporting. Historically, NHS support workers have faced a number of issues. 2 years ago, ACCEND undertook a study of this workforce and found out, for example, there's often a lack of standardisation. For example, lots of different titles or different entry requirements. Job design can be inconsistent between services. This workforce can sometimes have poor access to the education they need to optimise their contribution to care, and their career progression opportunities can be limited. This means that the contribution to care that this workforce makes is not always optimised. It also means that their experience of work is not always as good as it could be, and we also have a lack of career and succession planning. The ACCEND resources, the Learning Hub, the Competency Framework and the Career Ladder have been developed exactly to address these issues. So, what could we expect to happen if these resources are implemented locally? I've been looking at the research evidence base and also similar strategies that have been introduced for other parts of the NHS workforce. And it's really clear that actually the upsides are very considerable for organisations and for staff and for patients if these resources are implemented locally. So for staff, we know when these sort of resources are implemented, job satisfaction and morale can increase, and that can lead to lower turnover and less sickness absence and other types of absence. It can also lead to more engagement with services. We also know that if we can develop clear job competencies and scope of practice, this will have a number of other benefits, including improved delegation of tasks, which can free up capacity and time of other staff. And this also underpins safe care and practice. The ACCEND resources will not only benefit staff, they will also benefit employers. Implementing these resources locally will lead to productivity gains, for example, through lower turnover. It will also increase capacity and capability and improve patient outcomes. Looking at other areas, it is clear that there's a substantial return on investment for organisations that introduce resources such as the ACCEND ones. And most importantly, for service users, these resources will help improve care and help join up care. ACCEND is an opportunity to ensure that the contribution of this important workforce is recognised and optimised. And that's good news for staff, for services and for service users.